how are you?
Very well, thank you. It's a beautiful day.
It is indeed. We're just going live now, or might have done already. Facebook is taking a little moment. But so everybody, do you want me to call you Charles or Charlie on this?
Charlie.
Charlie.
Either.
So, Dr. Charlie Steward is a lovely, lovely man who is going to tell you more and more about himself, both as a doctor, as a geneticist, as a dad, as a carer, and someone who has a real passion for helping those effectively, those affected by epilepsy, correct?
Absolutely. Sure.
So tell us more about you and what you do.
So, well, first, most importantly, I am the father of two lovely, lovely little children, 7-year-old Imogen and 2-year-old Jasper. Both were born prematurely, and both have severe cerebral palsy, grade 4-5 GMFCS. We're not quite sure yet for Jasper because he's still so little. But when my daughter was 6 months old, she developed a very, very severe type of epilepsy called West syndrome. A little bit like what David Cameron's son had. And I was completely ignorant about epilepsy up until that point. And from then on, I decided to make it my journey in life to do as much as I could to understand epilepsy and try and understand how we can help people. So by training, I'm an academic. I spent all my career working on the human genome, actually on the Wellcome Genome campus near Cambridge. And when my daughter was diagnosed with West syndrome, I decided to take a look at all the genes that we knew at the time to be involved in epilepsy and see if we could understand them better.
And how are things going with that?
Well, yes, it's a really interesting collaboration because it's amazing. The epilepsy community, you reach out to people and they help you. It's just how it is.
Yeah.
We're a lovely group of people, whether that be clinicians or academics or other parents, you want to talk to. Everyone's there to help each other.
And that's just so lovely, isn't it? Especially because I think, partially because epilepsy is so complex and such a horrid thing, generally speaking, to have. No matter the types of seizures, the frequency of them, it's nothing anybody would choose. And it's horrid both for people who have seizures or people who are taking drugs for the seizures, even if they're controlled, and for mums and dads and people who love these individuals. And so there's generally a sense of loneliness, I think, and often depression, anxiety. And so once I think you find somebody who empathizes, who gets that, it's like, wow. And also because, of course, we know so little about the human brain, we really, really appreciate it when we find other people who are interested and working on understanding it and therefore contributing towards, fingers crossed, better treatments in the future, right?
Absolutely. And I think what I've understood is that nobody can know everything about epilepsy. There's the genomic side of it, there's the clinical care side of it, there's the psychological side of it, there's all the sort of the familial stuff. You have to work as a group, I think, and you just become stronger with the more parts you have. So yeah, I've learned that very quickly. Obviously, it's been a very hard journey for us, and what worries, obviously, everyone who has epilepsy is it's so unpredictable. You just have no idea when it's going to crop up again. So yeah, learning how to understand these sorts of things will be absolutely imperative, I think, for us, if we can, obviously.
Yeah. It's often, I mean, this is going to sound really un-PC, but we as a society often think that it is just the people with the seizures and experience feelings of loneliness, sometimes unfortunately, and I think wrongly, shame. We shouldn't have to feel ashamed for having such a thing, but and it's not just us, it's dads, it's mums, it's siblings. And I was speaking to somebody else recently who, as a patient with epilepsy, said that we should be talking more about siblings who sometimes miss out because the attention goes right on the one or two other siblings with epilepsy.
Yeah, absolutely. And I had the same experience with friends as well. They say, you know, they may have one child who's very ill with epilepsy, and the other child is completely fine, and the child who's fine is almost neglected, not in a sort of in a really nasty way, but it just in the way that just can't be helped. The other child needs so much help. So yes, it impacts the whole family, and I'm sure even further out than that, you know, with friends as well. I mean, sometimes we find ourselves completely isolated, well, as we are actually at the moment anyway. But you know, this is kind of not too dissimilar to how life is normally for us. You know, there are certain things we can't do just because of, you know, the conditions that the kids have. So yeah, it's hard, but
I think so. That's what we kind of need to work on, I think, as a global as well as local community, is meeting needs outside of the epilepsy directly, you know, social, personal, and sometimes it's just really good to let the person know that they're not alone, and you might not understand, and most of the time you won't. Even if your child has the same epilepsy diagnosis, you won't understand exactly where that person is coming from, but just knowing they empathize, that can be enough, I think, sometimes.
of course it can. Yeah, it's amazing the strength you can take from other people. Just like that, all the different support groups that you see, they are so important. And I think this comes back a bit to what I do with, you know, my job. You know, these gene-specific epilepsies. You know, once you have a genomic or genetic diagnosis, then you know that really is psychologically important, because it can sort of bring about a bit of closure potentially as to why the epilepsy is there, but also you can build so much strength with each other, and you know, do things like championing your disease and looking for specific therapies. These social media groups are just fantastic. Absolutely, they really are.
And without social media, we would never have met as well.
We wouldn't, no. And the world's a much better place now that we know each other.
Indeed. And so everyone knows, we don't even talk about epilepsy that much now. Talking about other stuff, but I won't go into that now. Yeah. Thank you so much, Charlie. If anybody wants to contact you or learn more about what you're doing, how should they do that?
Well, you can contact me on Twitter. I am Charles A. Steward. That's my name on Twitter. And on LinkedIn, I'm again Charles A. Steward, so you can contact me there. Probably those are the best two. So yeah, anyone, please feel free to contact me. I'm very happy to connect. I'm a sociable person and hopefully a nice person. So yeah, reach out to me, and very happy to talk more about epilepsy and particularly genomic medicine if you want to.
Perfect. And also, so everybody knows, Charlie is going to be blogging for us as well. It's in process, correct?
Yeah, absolutely. Yeah.
Lovely. And possibly a series, because there's so many things that, you know, we can all cover.
Have talked about a lot of stuff, haven't we? There's a lot of stuff that we've touched on, which, yeah, as I say, could be a series of sort of short blogs. Very happy, yeah.
Perfect. Thank you very much, Charlie. I'll speak to you later.
You too, Torie. Take care. Bye.